Hello everyone, I'm Brittany Aubain, filling in for Kib and Aline, and today is Tuesday, March 28th. You are now watching Open, a live program bringing the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. In the month of March, healthcare professionals recognize Multiple Sclerosis Awareness Month. Throughout the country, time is dedicated toward educating people about the disease and how it's affecting the lives of those who live with it. Neurologist from Montefiore Multiple Sclerosis Centers, Dr. Lauren Gluck, joins me to discuss. Dr. Gluck, thank you so much for joining me today.
Thank you for having me.
So to start off, can you just give us a brief overview of what is multiple sclerosis?
Multiple sclerosis is a neurological disease that happens when the immune system attacks itself. Now, we have been hearing about the immune system with COVID for so long. We know it's supposed to protect us from infections, but sometimes it gets confused and starts attacking our own body. And in the case of multiple sclerosis, it can cause damage in the brain, the spinal cord, and the optic nerves that help us see. So multiple sclerosis is actually the most common cause of neurologic injuries next to trauma, next to actual physical injury in the country.
And who is most at risk for this disease?
The most common onset of this disease happens in people when they're in their 20s or 30s, although it can affect people as young as children and as old as their 70s or 80s. But it is most common to turn up in your young adulthood. We think it's more common in women, but plenty of men have this disease. It's common across all ethnic and racial categories. It doesn't necessarily run in families, although in people who have other autoimmune diseases in their family, they may be at a slightly higher risk. But this is certainly not something that passes down guaranteed generation to generation.
Thank you for clarifying that, because I was going to ask if there are any genetic variables that run into being diagnosed with MS, but if there are any more particular causes that lead to MS, can you explain that a little bit?
Of course. It gets a little complicated because there is a genetic basis. There are pieces of genes called alleles that a person has to have over 200 of them to be at risk for multiple sclerosis. And that's how some of that relationship to family comes into play. But then other things affect a person at risk, like their environment, particularly smoking cigarettes, having childhood or adolescent obesity. And there is more and more evidence that maybe being exposed to a virus called Epstein-Barr, which causes the mononucleosis or mono or kissing disease, may be that extra risk factor that makes someone at risk develop the disease in actuality.
Thank you for clarifying that. And also, the age range for somebody that MS most affects are women between the age 25 and 44. Now, this is a time in which women are, wanting to go all in on their families or on their careers. So can you tell us if there are any signs that someone who's developing MS should look out for?
So the signs of an MS attack or exacerbation or flare-up include weakness in one limb, like an arm or leg or half the body on the same side, that happens over a day or a few days. It can be numbness in one arm or one leg or half the body. It can be decreasing vision in one eye. And now these sound like very scary symptoms that, of course, you would go to a doctor about, but especially when we're busy, if you have young children at home, if you have a job or things just going on, we rationalize a lot of things that happen to our body. Sometimes that's okay. Sometimes it is important to take that more seriously and kind of take stock of what's going on. So if something happens that's progressing over a few days, that is very much outside of your normal, it's worth checking in with your doctor to make sure that nothing more dangerous needs to be addressed.
Thank you. And is there a particular age in which we should start looking out for these signs?
So the wonder of neurology is that so many things happen in our body on a daily basis that may not be 100% normal. You
Hmm.
may feel a twitch or a tingle or a headache, and if it lasts, generally speaking, for a few seconds or a few minutes, sometimes even a few hours, it's likely okay.
Hmm.
Um, but so I never ask people to like write down every abnormal thing they ever feel, because you can really go down a dangerous path that way and get hyper focused on things that you don't need to. Um, so, like I said, the guideline I tend to give my patients is, if you notice something getting worse over the course of a day, maybe into the next day, that's the time to call your doctor. Um, if you're older, though, if you have high blood pressure, high cholesterol, diabetes, heart disease, and you suddenly develop a new problem, like all of a sudden weakness, all of a sudden vision loss, even if it only lasts a few minutes, we do have to consider stroke. And that is a much more emergent problem where you have to go to the hospital. But because multiple sclerosis tends to affect young people more, who have fewer of these other comorbid illnesses or additional illnesses, that tends to be a very different conversation. But since I'm talking to everyone, I want to make sure that that's clear too.
Absolutely. And can you tell me a little bit about how this disease affects somebody's everyday life?
So multiple sclerosis affects everyone differently. So I say everyone's MS is different. That some people feel fine. Some people feel mostly fine, but have days when they're very fatigued, or they have nerve pain that comes up every so often. And some people who've had damage to their nervous system that causes ongoing weakness or difficulty walking. And so, an important thing to think about is, it may not be the same every day.
Hmm.
You may have to change what your normal level of activity is. But the purpose of having a doctor and having a neurologist, and ideally having a multiple sclerosis specialist neurologist, is to help keep you living the life you want to live and protecting you from this disease.
Absolutely. And speaking of living the life you want to live, what are the medical and social aspects of caring for people with this disease?
The first thing that's important to know if you have a friend or a loved one who has MS is to listen to them. They may feel different on different days, and it's not because they don't want to hang out with you, or because they don't want to go to your event, or they don't want to call you on the phone. Some days they may feel worse, and it's not personal, and they're not making it up. It's a very variable illness that hopefully people feel well most of the time, but sometimes that's not the case. So I think that's the most important, most basic thing I'd say to anyone with a loved one with MS. Um, but so it's important to listen to them. It's important to kind of recognize the speed they need to move at, both metaphorically and literally, um, and help with, you know, dealing with stress. And if they need someone to listen to, that can be a really good role for you to take with your loved one, to listen to their needs.
Yeah, for sure. And what does treatment look like for this community?
Mhm. So, unfortunately, right now, there's no cure for multiple sclerosis. There's a lot of research going into it, though. But we do have a lot of excellent treatments that help control the disease and prevent more disability related to the disease, both physical and mental disability. So there's more than 20 FDA approved medicines to prevent multiple sclerosis related disease. Um, and I generally recommend for all of my patients to be on one of them, but depending on patients' uh, severity of their disease, how they are feeling, what they're kind of willing to take in terms of medicine, other medical issues, different medicines are right for different people. And that's a big conversation that you should have with your doctor.
And as you mentioned, I want to circle back to when you said there is no cure, and you're absolutely right. Now, there has been much progression over the last 30 years when it comes to MS treatment. So, can you talk a little bit about that?
Yes, so the first MS therapy to control MS disease came out in 1993. Now, that's in my lifetime. So since then, we've developed much more effective relatively safe medicine that people can be on for a long time, because multiple sclerosis, once you have it, it stays with you forever. So it's a much better treatment landscape, we say in the medical field. More colloquially, I'll say, it's not your grandma's multiple sclerosis. People can be on medicine much more quickly into their disease, much more effective medicine that prevents that damage from building up over time.
And lastly, I just want to ask, how should families help their loved ones suffering with MS?
I think it's a very similar question to how can family and friends do this too, but listening to your family member is important, and encouraging them to make healthy choices. And the first part of that is going to the doctor. Sometimes people feel very overwhelmed when they're first diagnosed or after many years of diagnosis. But the purpose of the doctor, and what I see my purpose for my patients, is to keep people as healthy as possible. If they're feeling well, I want to keep them feeling well. If they're feeling less well, I want to help them feel better. So I think there's always a reason to follow up regularly with your doctor, to engage in exercise, in more healthy eating practices with more fresh fruits and vegetables and lean meats that we think may have a positive effect with multiple sclerosis, and doing things to decrease stress and promote mental health, because having a better outlook, better mood is also very helpful for all of these things.
Absolutely. Dr. Gluck, I want to thank you so much for joining us today. To stay updated with all the efforts of multiple sclerosis centers, please go to www.montefiore.org/neurology-services or follow them on social media at Monteeinst. Don't go away. We'll be right back with more Open after this.